will not work. Can you hear me?
Yes.
Okay, great. My name is Dr. Maja Trochimczik. I'm Senior Director of Planning at Phoenix House in Los Angeles. And Mr. Paul is the Director of our Venice program. We're here to talk about a grant program that we received and was funded by the Keck Foundation, and we're very happy to be doing so in a Keck auditorium in the presence of Keck School of Medicine staff and so forth, because the Keck Foundation is very, very active in supporting a variety of healthcare projects. Our purpose and goal for this project was to develop and implement integrated model of care.
This one here, next one. You put it a little higher.
We're trying to do integrated model of care to address comorbid problems of substance use and poor access to quality healthcare of patients who are enrolled in our substance abuse treatment at Venice House in Venice. And we had 4 goals set up initially. The first one was to increase access of clients to individual screenings and assessments because they didn't have enough healthcare screening and information. The second goal was to increase the number of clients served. Third goal was to establish new partnerships for the program and redefine current covered partnerships. And the fourth was to increase the depth and scope of contact and education mutually for both partners.
Good afternoon, everyone. My name is Errol Small. I'm the Senior Program Director at Phoenix House Venice. It's an absolute pleasure to be here with you all. Phoenix House Venice was brought to the forefront in 1986, and we have a long history of serving men over the years of over the age of 18 years old that suffer from substance use disorders, as well as co-occurring disorders. We do an excellent job, in my opinion, in terms of bringing men in with a formal and comprehensive assessment that consists of an ASAM criteria and screening out those individuals that we believe, screening, don't screening out just yet, but screening those individuals that meet our criteria as well as exclusionary criteria. We currently have 53 beds that we offer to the community in a residential manner, as well as 20 beds from an outpatient manner. Most of our clients do come to us without health insurance. They come with pre-existing medical conditions, and some, as I mentioned before, with co-occurring diagnoses. The residential length of stay is predicated on the funding sources, and we have various funding sources that we work with in terms of other providers. And as I mentioned before, in terms of any individual that's been referred to our program has a thorough assessment. That assessment then, if they once again meet our criteria, will pass on into a conversion into an admission, and then based on that, we will produce a treatment plan within the first 3 days of their stay. In terms of Venice Family Clinic, we don't have a representative from Venice Family Clinic that's here before that will represent for them. They were launched in 1970 as the clinic of first choice and affordable health care for low-income, uninsured, and homeless families and individuals within the Venice community. The clinic serves everyone from infants, children, and teens to adults and seniors, providing more than 114,512 primary care, specialty care, mental health, dental, and health education visits annually.
Now, our activities in the program consisted first of a ramp-up period, and then we had an implementation period. The ramp-up period was of 2 years. We had to find a partner agency, define how we're going to help our patients receive healthcare and be related to healthcare, hire new staff, and create linkages in place. In the implementation period, we were running the integrated treatment model, and we got gathering our data.
Yes, so the second phase of our plan and our collaboration with Venice Family Clinic was to go into the implementation phase. And before you do that, you have to be able to sit down with your partners. You have to be able to discuss what is most beneficial to our patients based on our programmatic design, based on the resources they would be able to provide to us to assist us with this implementation phase. So as a senior program director, it was incumbent on me to ensure that I had to hire the right people. First and foremost, you have the right to have the right people in the building to provide the services that you know that your clientele need. And with that being said, not only just the training, but to develop the procedures and the protocols to sustain the implementation process. So often what we see is there's not a healthy collaboration, or at least in our experience, there was unhealthy collaborations that led to inappropriate planning, is what I call it, which leads then to failed treatment experiences for our patients. It's incumbent once again upon us as leaders, it's incumbent upon us as administrators to ensure that this healthy collaboration takes place to sustain the level of quality services that we are to provide. So in terms of measurable outcomes, these are what were agreed upon us receiving the KET grant. 75% of clients screen for physical health, mental health, and substance abuse issues. 25% of clients referred to be treated for a new health issue. 85 clients in total to be served in a collaborative treatment program, that treatment program being Venice Family Clinic. And lastly, for Phoenix House Venice to improve upon our dual diagnosis capability.
In terms of the number of clients, we served over 900 clients in the entire period. Just for statistics, majority were not Hispanic, 40% Hispanic, Black 24%, white 54%, and other 20%. 22% were previously diagnosed with mental health issues. New diagnosis was discovered during the grant process. The drug of choice was varied with not a clear preference: cannabis, alcohol, opiates, opioids, and so forth. We had two cases that we have as clients just to mention. One of them was a client who was on medication-assisted treatment thanks to this grant, and he received 2 visits, one in Venice Family Clinic for 2 months of treatment, and then after leaving the clinic, received additional treatment for more than 3 sessions. And this client is doing well in heroin addiction, so he is in recovery. Another case was when we discovered a client who had HIV and also received treatment and is still ongoing treatment in the program.
In terms of project outcomes from Venice Family Clinic's perspective, not so much Phoenix House Venice, 103 Phoenix House Venice clients were served at the Venice Family Clinic site during the implementation period between July 1st, 2016 and June 30th, 2017. 121% of the proposed 85 patients that we were to send. So there's gain there. They're seeing more clients, and we're treating more of our patients that have these identified issues. 97 of those patients went to Venice Family Clinic for primary care, another 2 patients for specialty care, another 9 for mental health services, another 21 for ancillary service, and 21 of our patients went there for some dental care.
And in terms of project outcomes for Phoenix House, we're really very happy that during the program period, our dual diagnosis capability increased significantly. As you see on the slide in the middle, we have a number 5, continuity of care has increased to the full 3 points on the scale for DDCAT, which went up by 1.4 points, which is really a very dramatic increase. It's thanks to the collaboration that we have now, the continuity of care after treatment, which is very important. We also increased the treatment quality and assessment quality in the period, which moved us from the program that only serves alcohol clients, to the program that also serves mental health and other issues for the clients. And we're very proud of this outcome because it really makes a huge difference for our clients.
Absolutely. In terms of project outcomes, in terms of goals as well, goal number 1, as Maya had mentioned, was to increase access to individualized screening and assessments. I'm very proud as a senior program director to let you know, through our healthy collaboration with VFC, 100% of the men in our program have access to insurance. 100%. When I first went to Venice, it was about 49%. So roughly half, obviously. it's very important for us to make sure that these screenings take place, that the men with pre-existing conditions are met with and get the medical care necessary. Historically, Phoenix House Venice has catered to the criminal justice system, and we would get a lot of men out of prison with a lot of pre-existing conditions who would come to us, and based on, at that point, not having the mentality of partnering with our community providers, we were falling short. And we were, in a lot of cases, doing harm, which we know as clinicians, the first thing you don't do. So we had to pivot, and we had to look at things differently. And we are so grateful for the tech grant, because it allowed for us to be able to partner with Venice Family Clinic and address some of the pervasive issues that was affecting this population. So 100% of our men at Venice, at our site, have medical health insurance. It's a beautiful thing. And what we set up in our partnership with VFC, Venice Family Clinic, is the fact that they come to our site every third Wednesday of the month. And for every admission we have for the previous month, they make sure they get those men enrolled. So they have Medi-Cal coverage. Every man that comes through our facility who doesn't have it has the opportunity to gain it while they're in our program.
We got to cut you short here. Sorry.
Oh.
One more sentence.
One more sentence, huh? All right, let me go to this goal right here. In terms of goal number 3, establish new partnerships. Yes, the same partnership. The collaboration in terms of Hep C and HIV. The third Thursday of every month, we have VFC nurses come to our site, and in a voluntary manner, our men sign up to get HIV and Hep C testing. On average, I have about 14 to 16 guys that partake in that every month. Once again, it's something through psychoeducation that we provide them within the substance use disorder treatment service that we provide that allow for them to understand a little bit more about the conditions and what they can do to hopefully get the help that they need.
Thank you so much. Sorry for running late. They can have questions at lunch break.
Okay, great.
We have to have lunch break. Sorry. We're way behind now. So we need, thank you so much. Next we have